So thanks everyone for joining us today for the Tobacco Endgame CRE webinar series. Today we're going to be looking at tapping into data, so exploring available secondary data sets related to tobacco for public health research. My name's Holly. I am the CRE Career Development Committee Chairperson, so it gives me great honour to chair this session today and for Ara. So without further I won't hold it off anymore. Dr. Ara Cho is a postdoctoral research fellow at the School of Public Health at the University of Queensland, and she's also a research and development officer for the CDC committee. Dr. Cho's research is focused on the impact of tobacco tax increases on smoking and tobacco purchasing behaviours. Her current research focuses on the unintended consequences of the tobacco tax increase, including illicit tobacco use and financial hardship among individuals who smoke. So I'm very much looking forward to this presentation, and I'll pass you all over to Ara.
Thank you so much, Holly, for your lovely introduction. I firstly would like to start this webinar by acknowledge the traditional owners and their custodianship of this land on which we meet today, and I pay my respect to their ancestors and their descendants. As Holly mentioned in her lovely introduction, I'm a postdoctoral research fellow in our center, and I also served, like Holly, as a research development officer on our CRE's Career Development Committee. So recently, I've been receiving quite a lot of questions from my colleagues and friends and students about the surveys I've used. So in helping them out, I realized that this webinar can be benefit for some researchers, especially who are new to quantitative research or haven't used surveys before. I'd like to start with this cartoon that effectively represents quantitative and qualitative research. It shows a scenario where free ice cream is offered, and the responses to that offer illustrates the differences in different research designs. So quantitative researchers would observe how many out of 30 people took the free ice cream, while qualitative researchers would interview participants more about their feelings and reasons for accepting this offer. So today I will be discussing one of the quantitative research methods, that is the secondary data analysis. So while I preparing for this webinar, I actually thought a lot about what might interest participants and what they would like to learn more about it. So I believe many of you joined for various reasons. So to kick things off, I've prepared a mini poll to get your experience with data analysis. It consists of 3 simple questions. So Julia, can you please launch the mini poll for me? Yeah, so I'd really appreciate if you could take a moment to respond. So the results will help me to tailor this webinar to your needs, because I know like there are various participants from different groups. So it will be, only takes about 1 or 2 minutes. So I will just give you 1 or 2 minutes to complete this poll. So the first question is about your previous experience using secondary data sets in your research. And the second is that it's about how comfortable do you feel about using those data sets for your research. And the last question is about your biggest concern when you think about or plan to assess the secondary data sets. Yeah, Julia, can you please show some results for me? Okay. Yeah, so I can see that half of the participants actually have sometimes use secondary data sets, and 1 in 4 actually frequently use it. And then in the second question, also 1/3 said that it's very comfortable to use those data set, while another 1/4 is not feeling not comfortable. Maybe they are the participants who are new to the data set or statistical analysis. And majority, not majority, 60% said that the biggest concern is about the complexity of data. I really do agree with you. And half of participants respond that finding relevant data set is challenging, and the statistical analysis method for their planning is quite challenging. Thank you, everyone, for participating in this poll. It's really, good opportunity for me to understand the background from the audience. So while our sample size is quite small, but it's clear that some researchers, especially those new to data or building their experience with data sets, often find the initial steps challenging. So I'd like to compare this to facing a high wall, which is how I felt when I first started with data analysis. However, I've designed this webinar to serve as a ladder. So I hope helping you to see the interesting possibilities that lies beyond that wall. So today, in this webinar, I will highlight some benefits of secondary datasets in public health research, particularly in tobacco control area. And I also introduce some surveys and its characteristics and tobacco-related variables they collect for the new researchers. And for already experienced researchers, I will give some update on the latest survey questions, for example, in the NDSHS. Lastly, I will guide on assessing datasets and navigating the approval process. So what are the secondary data sets? So the secondary data set is the pre-existing data. So data is already actually collected by researchers for a purpose other than the current study. So it can be government reports, surveys, or a part of academic research and organizational databases. Using secondary data offers several advantages. First, these data sets typically have large sample sizes, which enhance the reliability and validity of research findings. Additionally, secondary data sets allow for consistent replication of studies, contributing to their robustness. And data often represent the population, making the result more applicable to real-world settings. Using existing data also reduce the need for primary data collection, save both time and resources. From an ethical standpoint, secondary research is often classified as lower risk, which can result in obtaining ethics exemption more easily. I actually like to think of secondary data analysis as cooking with well-prepared ingredients. I ask AI to create an image related to this thought. And so if you had to harvest some like onions and potatoes from farm, you need to also wash and prepare ingredients for a delicious dinner. It would require a lot of amount of money and time and effort. However, secondary data, as I mentioned, is usually systematically collected and cleaned by other researchers or institutions, so making it a useful resources if you can access it. This is particularly important in the field of tobacco control research. We can identify tobacco use trends through various data sets and observe behavior changes using longitudinal data. Moreover, these findings can provide evidence for establishing more effective tobacco control policies and evaluating existing policies. There are a variety of surveys collecting data on tobacco-related variables. So today I will focus on a few surveys. For national surveys, I've included those that recruited adults in Australia and collect smoking-related variables. For international surveys, I know there are already good resources in each country, but I've only included those that include Australia and allow for cross-country comparisons. Among this, I will take a closer look at the NDSHS and ITC surveys that collects a particularly large number of smoking-related variables. So first up is the National Drug Strategy and Household Survey, which is run by the Australian Institute of Health and Welfare. So this survey collects information on alcohol and tobacco consumption, as well as illicit drug use among the general population in Australia. It also collects people's attitude and perceptions related to tobacco, alcohol, and other drug use. The survey has been conducted every 2 or 3 years since 1985, with the most recent data set being from 2022 and 23. The sample for each year was selected using stratified multi-stage random sampling based on local areas in each state and territory. The AIHW contracted a private market research company to carry out the survey fieldwork, and around 21,000 people aged 14 and over completed the survey in the recent survey. Currently, the data set from the 2022 and 23 survey is available. So I will take a look at some tobacco-related variables based on the latest survey. You can find questions on tobacco, e-cigarettes, and policy support in section C, D, and WY. So starting with section C, it's all about tobacco. So it addresses tobacco use. So the first question is about household secondhand smoking at home in the past year. And they ask participants to about the smoking status, frequency and amount, and current tobacco product use. I'd like to highlight that in the latest survey, they actually added one response for current tobacco product use, that is menthol cigarettes. That is the new response in the latest survey. And they also asked where participants actually purchased tobacco products from. I found several published papers that use these variables, examining daily tobacco smoking patterns and prevalence by industry and occupation. Since there is a gender variable included in the NDSHS, so some studies also explored smoking prevalence and related factors based on gender. Additionally, there are many questions related to other drug use, allowing for research on co-use with cigarettes as well. Since the survey collects data cross-sectionally, they ask about the changes in smoking behavior over the past 12 months. Additionally, they also ask about motivations for trying to quit or give up smoking, which include health-related factors, social pressure, economic factors, supports and information, as well as policy-related factors. As an example of using these questions, I actually brought my publication. I used these questions for my very first PhD paper, and I was really grateful for the significant media attention it received. I must say I feel a bit embarrassed about how frequently I use this attention. But what I'd like to emphasize is that using national survey is really beneficial because they effectively represent the general population in Australia, so making them excellent for disseminating results. The survey continually asks participants about their intentions to quit smoking. So participants who indicated they have no plans to quit smoking are more asked about their reasons for not intending to quit as well. It also asks about factors that might motivate participants to quit smoking with multiple response options available for selection. I apologize for this dense text on this one slide, but I try to summarize the various options for smoking support use into one slide, which focus on participants' use of cessation support over the last 12 months. I also found two interesting studies that you have used these variables. One is an earlier publication that examined the smoking cessation use and quit support services based on socioeconomic status using multiple waves of data. The other surveys focus on the effectiveness of e-cigarettes for smoking cessation success over the past years using data from 2019 only. At the end of this section, tobacco section, there are questions regarding illicit tobacco. The survey investigated two types of illicit tobacco. The first one is tobacco products that lack plain packaging or graphic health warnings in the past 3 months, not in the past year. And second one is about unbranded illicit tobacco, commonly referred to as chop chop in Australia. One research team published a paper using these variables, so examining whether the unbranded illicit tobacco use has increased over the study period and who is smoking these products by analyzing data from 4 waves. Following section C, the tobacco section, section D includes questions about e-cigarettes. One recent change I noticed in this survey is that questions about the e-cigarettes, which were originally part of the tobacco section in the previous waves, that have been moved to a separate section. Using some variables about e-cigarette use, researchers have examined the correlates of e-cigarette use as well as the association between the increase in e-cigarette use and smoking reduction and cessation. The survey also asked about the main reason for using e-cigarettes. It also asked where participants obtain their e-cigarettes. At the end of the section, it asked whether the e-cigarettes used in the past contained nicotine and whether they were obtained through a prescription, and if participants face difficulties in reducing or quitting e-cigarette use in the last year. These questions were added in the 2020 and 2023 survey. These questions wasn't in the previous waves. In section WY, this section focused on policy support related to tobacco. So support, the support questions include topics such as increasing tobacco taxes, banning tobacco products, advertising on social media, implementing a national licensing schemes for tobacco retailers, and prohibiting all additives in cigarettes. I found a study that examined the level of supports for the licensing tobacco retailers using data from 2004 to 2016. Various statistical analysis methods have been used to analyze the NDSHS data. Primarily, multivariate logistic regression analysis was conducted, along with multi-group latent class analysis and age period code analysis, depending on their research questions. Next, I'd like to talk more about the NDSHS web report. This primarily includes materials released before the data becomes publicly available. So I want to especially highlight the data table here from the website, because I use this variable when I'm planning my research and after initial analysis. Before starting my research, I check whether I have enough sample size, and after my preliminary analysis, I always double check my estimated results align with the official figures. As I mentioned earlier, the reproducibility of findings is a key advantage of the secondary data analysis. So it is really important to ensure that your results consistently yield similar outcomes. Next, I'd like to talk about how to apply for the data. So there is a platform managed by ANU called Australia Data Archive, which collects surveys primarily funded by the government. So you can actually explore a variety of data sets through this search function. And to access the data, you first need to create a new account. When you search for NDSHS, you will encounter this page. And as you scroll down, you can see various related files that include the data, such as data dictionary, technical report, questionnaire, and data sets in SPSS and Stata. To request access, there are 2 steps you need to complete. First step is you must fill out the online form. Second one is you need to complete the provided data access application materials and send them signed to the official ADA account. It's a bit complicated, but you must follow the 2 steps. And to submit an online form, as you can see, click the icon next to data and click the request access. Then the online form with the dataset terms will be appeared like this, and read it carefully and start to fill out the form. There is a section asking you to provide a short abstract summarizing the intended use of this data. So I recommend to prepare one with your team or supervisors for this. And unfortunately, I wanna note that there isn't a save option here. So I highly recommend to save one in a Word file and then just copy and paste in the online form. And as the second step, if you go back to the first page, you can find data access application materials here. And there is the form instructions guiding you to check all the forms. So read it carefully and complete all the forms and sign the confidentially undertaking form if you are the data users, and send them to ada@ada.edu.au. So before I move on to the next survey, I'd like to check if there is any questions about NDSHS. Also, since I can't actually see you all because of the nature of the webinar, could you please provide the feedback on how things are going by clicking the react icon at the bottom of your screen? Any reaction like heart or thumbs up would be very appreciated. Oh, that's lovely. Thank you, everyone. Yeah, just take some time if anyone has any questions. Okay, I think I can move on to the next. You can also ask any questions after I finish the presentation. Okay, so next I will provide a brief overview of several national longitudinal surveys. I've summarized four surveys in total. So while they collect limited data on smoking-related variables, they do have diverse populations and other useful smoking-related variables. So the first one is the household income and labor dynamics in Australia survey, which is another government-funded panel survey of the Australian residential population. They focus on income, employment, and family dynamics. They launched this survey in 2001, and it includes a diverse samples of more than 17,000. And the data is collected through interviews with household members, capturing detailed information about household composition, as well as individual characteristics. The topic from this survey is coverage is quite broad, but with the focus on income, wealth, employment, family, and health. In the self-completion questionnaire includes questions about smoking and e-cigarette use. While smoking-related questions have been collected across all waves, they have 21 waves so far, but unfortunately, data on e-cigarette use was only collected in a single variable in 2021. So here the survey data have also been used to evaluate a health policy. For example, this study showed how reforms to pictorial warnings on cigarette packaging lowered smoking rates in Australia. One benefit I found in this survey is that there is a weekly expenditure question, and it includes cigarettes and other tobacco products expenditures on a weekly basis. Given the high cost of cigarettes in Australia, I think understand this expenditure is really important. So a study in 2022 used this data to examine the household expenditure of smokers, individuals who smoke across different socioeconomic groups. Here, the survey website provides very well organized collections of variety of resources. Those interested are encouraged to explore for more information. Here that also offers training and workshop opportunities. I actually participated in a training session earlier this year, which was really helpful. And the workshops focus on longitudinal analysis using data, but unfortunately it's not free. From my memories, it was quite expensive. And when I check it recently, it seems like this year's training and workshop opportunities have been all concluded. However, those interested should keep an eye out for future sessions. Like the NDSHS, here the survey can be also assessed through the ADA. So next survey is the Australian longitudinal study on women's health, which consists of 4 cohorts that are followed up over time. This survey focused on women in Australia. So I only brought the one cohort profile for the youngest age cohort among them. It recruited women in Australia aged 18 to 23 who were eligible for Medicare in 2012 and 2013. So its purpose is to provide evidence to inform the development policies and practices in women's health and health services. As you can see, it does collect several smoking and cessation-related variables. And I found several, not really that many, but several studies have been published using this data. For example, examining topics such as smoking patterns among Australian women and the association with psychological distress and connection associations to specific disease or trajectories. For those interested in, our web page is available where you can search for more studies using keyword. There is also a survey focused on Australian men. This survey has been targeting about 15,000 men aged 10 to 55 since 2013, and data has been collected 4 times so far. This survey also includes some questions, but not many, about smoking status, making it possible to conduct some research on Australian men similar to the studies done on women. The last national longitudinal study is that the 45 and up study, which is managed by the Sex Institute. This survey is a population-based survey that recruit over 267,000 participants aged 45 and over from a single state with New South Wales between 2005 and 2009. It has over 15 years of survey data linked to NBS and PBS data, allowing for time series analysis and identification of risk factors and health outcomes. This study also includes some questions about smoking. So however, since the participants were over 45 at the time of recruitment, and it has been followed up for 15 years, they are now considerably older. So it makes studies examining the correlation with smoking a bit challenging, I think. However, the ability to link with other admin data may make this study more useful for aging-related research. And unfortunately, this data is not for free. However, there's some research grant opportunities specifically for project in the cardiovascular project. So those who are interested should consider exploring this option. So now I'd like to shift our focus on international surveys. Finally, it's about the International Tobacco Control Policy Evaluation Project Survey. So you may have heard a lot about the ITC survey if you are the researcher in tobacco control. And the ITC survey started its first project since in 2002 to measure the psychosocial and behavioral factors of smoking in 4 countries, including Australia, Canada, the United Kingdom, and the United States. It's a prospective study of more than 2,000 longitudinal respondents per country with yearly refreshments. So this survey consists of 2 main sets. The first set is the 4 country surveys, which conclude 9 core surveys of adults who smoked between 2002 and 2015. The 4 country survey expanded 4 country smoking and vaping survey in 2016 to examine the nicotine vaping market and divergent policy environment in 4 countries. Between 2005 and 2022, 27 other additional countries have joined this project. The ITC has also published profile papers on their conceptual framework and methods related to this project. This diagram from one of their publications illustrates the conceptual model of the ITC survey, which is designed to evaluate the impact of tobacco control policies on smoking behaviors. It collects data on policy-related variables and psychosocial mediators and policy outcomes to assess how these factors influence tobacco use among individuals who smoke. The biggest table provides a clear overview of how the samples are structured across the countries and what available data is included. As you can see in the right-hand table 1, there are substantial number of records and variables only related to smoking, so collects across the 4 countries. Therefore, I hope you understand that it can be really challenging to review each variables individually for me, so similar to NDSHS. So for more details information on the variables, you can refer to the data dictionary. The ITC survey can be used research-based solely on data from just one country, or it can also use comparisons between different countries. One of the advantages of this survey is that they have the same questions collected across different countries. First, I have brought a few studies that exclusively use Australian data to examine the impact of policies in Australia. I was able to thankfully publish 2 of these papers as part of my PhD research. Since each country implements different policies, it is possible to conduct research that evaluates the impact of these policies, such as about e-cigarette, like prescription model in Australia and tobacco taxation.
Ara, sorry to interrupt you. We've just got Sam who's raised their hand. I was wondering if there was a particular...
Okay. Yes, Sam, please unmute and ask me a question if you have.
Sam, you should be able to speak now if you unmute yourself.
Oh, accidental. That's fine. Never mind.
Okay.
Okay.
Thanks, Sam.
Great. Yeah, please pop your question in the chat box if you are comfortable with text. So additionally, as mentioned earlier, similar question and sometimes the same question collected across countries, it allows for research that use both Australian data and data from the other countries together. However, what I want to emphasize here is that even though the same questions were asked, the research period is actually sometimes vary between countries. So if you are examining the impact of a specific policy, it is also very important to verify these timelines carefully. For the ITC data analysis, 2 main methods are typically used. In case where a single wave or cross-sectional study is conducted, multivariate logistic regression analysis can be conducted. And for studies using multiple waves in a longitudinal design, generalized estimating equations are often used to account for participants' repeated responses across the wave. Occasionally, difference in difference analysis are also used to assess the pre- and post-policy effects. You can find the suitable analysis method in the previous studies based on your research question. I briefly introduced the process for applying this data. So if you do not have any affiliation with the ITC project, you will need to follow the external process. As shown, you need to complete and sign 3 documents and send them to the ITC team. However, it is important to discuss your proposal with your team, supervisors, and the principal investigators beforehand. So sometimes, even if you have a great research topic, another research may have already submitted a proposal, and it could be under review at that time. So for Australian ITC, our center's director, Professor Cora Gardner, and research fellow Dr. Kylie Murphy are the PIs. So I highly recommend discussing your topic with them if you are interested in using this data set. I am also involved in several ITC projects, so I can also assist with analysis and as well as your plan. So please feel free to reach out our team. You can find the external request package on the ITC website, and the URL is located in the bottom right corner in this slide. Before I conclude this webinar, I'd like to highlight a few important points. First, while I wasn't able to cover all variables from each wave and each survey, it is very important to check for you whether the questions have changes or not if you're using data collected over time. Additionally, sometimes the sub-questions may have lower response frequencies than your expectation. So for instance, when I try to use the economic reason for e-cigarette use in the NDSHS, I found that the frequencies was very low in Australia because it's the sub-question. So I had to perish the project during my PhD. So this experience prevented me from proceeding with that research. So therefore, I highly recommend using the reports from each survey to plan your research effectively. I also want to mention that while I didn't go into details about the analysis method in this webinar, it is very important to use the appropriate weight when estimating weighted proportions for your research. I actually started today's webinar with a very fun video. I really appreciate Julia to find this fun video for me and for other participants. And I hope the information shared today have been helpful for you looking to use secondary data. Thank you for all your attention.
Thanks very much, Ara. That was a really interesting presentation. You provided a really nice overview of all those secondary data sets as well. And some of those data sets we might not even consider. So thanks very much. We're going to open up for questions now. If you'd like to put a question in the Q&A, or if you raise your hand, we can unmute you if you want to ask Ara directly. Just while people are having a think, I have a quick question, Ara. I was wondering if you had encountered any issues or challenges in the actual requesting process of these data sets.
Actually, assessing the data process is quite simpler than I thought. So I actually didn't have like much issues to make the process to get the data. But recently I found my one mistake. That is that I recently requested the latest NDSHS data set, and I didn't know that they changed their policy to provide the variable about sex at birth, because usually they just basically provide researchers that variable, but I noticed that they changed the policy providing the gender instead of age and sex. So I didn't really catch that point, and then I had to ask them again to get the right variable I want to use. And they are usually very friendly. So yeah, I always ask question if I encounter some difficulties to fill in the form. So yeah.
Is it a fairly quick turnaround from requesting and receiving?
Oh, yes, yes.
Yep.
So once you submit the application, it usually takes within 2 weeks.
Okay, great.
The approval. Yeah. And then in terms of the ethics extension, it only takes like less than 2 weeks as well. So
Wonderful. That's really
yeah.
good. So we've got, so it's not a this is from Nathan, not a question, sorry, but thank you for a super helpful webinar, Ara. Some terrific takeaways here. And I completely agree. Does anyone else have any questions for Ara? Oh, great. Okay, great talk, Ara. Do you have some general advice on how to identify appropriate variables for research questions when using secondary data, especially with complex surveys like ITC, sorry?
Oh yeah, my one of suggestion is to find a relevant paper, like the previous paper, that might use the variable you are interested in, because I completely understand the complexity of the secondary data, especially when you actually open up the data dictionary for the ITC survey. I actually got so overwhelmed when I firstly used that data. But what I try to do is that try to find the relevant previous study, because they usually already have good definition. And then because they already been peer reviewed, they didn't, the paper doesn't really have any issues about the definition using the variables to use. So yeah, that is the one tip. And then using the data dictionary is quite hard sometimes, but it is actually really essential steps you need to when you plan your analysis. So yeah, please get familiar with the data dictionary as well. And then in terms of the weight, I didn't really cover that much today, but what I experienced about weights using ITC is it is very confusing. So what I did was that I asked the experienced researchers in the US, and he was super friendly. And then I tried to explain my plan and with more details than the proposal I wrote. And then he actually take a look at all the research questions. It really depends on your research question. So he gave me really good advice to choose the right weights. So yeah, I think that's my advice about the ITC.
Great. That's a great question. Thanks, Jiang. We've also got a question here from Kate, and she was wondering about youth data. So from the great table you provided around ITC data, it looked as though the ITC only collects youth data for Southeast Asia. Did I read this correctly, or are you aware of any other existing data sets that include youth data in addition to the national drug strategy?
Yeah, thank you for this question. I actually didn't include the youth surveys because there are a lot out there. So so I'm not really too sure about the surveys recruit youth, but NDSHS actually recruited some adolescents, but I guess the number of sample size is not enough. Maybe because that's the reason most of the researchers actually don't use NDSHS for the youth population. And in terms of the e-cigarette use on youth, in youth population, my understanding is that there isn't any like publicly available data set like in the general population. So I can see many researchers recently got many grants about it, and then they start to collect more data sets like specifically on the youth vaping behavior. So yeah. Oh, and Kylie raised.
Yes, can you hear me?
Yep, we can hear you.
I was just going to say there is an ITC youth and vaping survey, but it is run separately from the adult one. and it's run by Dave Hammond in Canada. I don't have experience accessing that one, so I'm really not sure what the process is. But you could look online. I think they do have a website.
Great, thanks, Kylie. Any other questions today for Ara? So if you think of any more, I'm sure Ara's happy to take any extra questions via email. Is that right, Ara?
Yeah, sure.
Great. Well, if there are no more questions, I will once again thank you all for coming today, and thank you, Ara, for a great presentation, and thanks, Julia, for your support today. And we'll call the webinar to a close.
Yeah.
Great.
Thank you,
Have a great day,
everyone.
everyone, and thanks for joining us.